Hey Bert, how are you?
I'm wonderful, thank you.
Good. We've known each other a while, and we've been working through some back issues and leg issues, correct?
Yes, we have.
And I think the first problem you had was pretty severe low back pain that you had for many years.
Yeah, it's very correct. For about
Really?
7 or 8 years before I seen you.
And really no one else had been able to make progress with you,
No,
correct?
sir. No, doc.
But I recognized that you had some modic changes on the MRI, and I said, gee, there's this new procedure called the Intercept, and I thought that would work well for your lower back pain.
Yes, you did, and
we
you
did
put
that,
it in there.
And we
And
did
worked
the
for about-
Intercept,
worked about 2 or 3 years.
and it worked quite well. So now since then you've had some pain into your thighs and down your legs,
Correct.
and a lot of difficulty walking, right? I don't think you
Yes.
could walk out to the mailbox hardly, and could only stand for like 5 minutes.
Yeah, I can only walk probably maybe 15, 20 yards.
Mm-hmm.
And
And
I
it was
in the
really
mailbox.
affecting your whole quality of life.
Oh yes, I was very immobile.
Mm-hmm.
Couldn't do a lot of things. Couldn't take the trash out. Couldn't wash put dishes in the dishwasher.
Yeah, sure.
The general things you do around the house.
Right. Mm-hmm.
And now I'm able to do all that. I mean, with a lot of flexibility.
Well, you had some injections by other doctors which didn't work, and then we decided that we were going to try and find a solution for you.
Correct, and you did.
Well, thank you. Well, we did the Minuteman Procedure, which is a spacer that we put in. It's actually a bolt which screws in both ends and holds that spine in place and increases the space in the spinal canal. And we did that just a couple weeks ago.
Yes,
And what have you noticed since then?
I've had a lot of relief, a lot of pain relief from my thighs.
Thighs much
And,
better. You sleeping better?
Oh, I'm sleeping better. That used to wake me up at night. It would get so bad.
Mhm.
I have not had that occurrence since you've put that Minuteman in.
And how and you can walk a lot further now.
Oh yes, I can walk probably a mile today.
That's incredible within just a
Yeah.
couple of weeks. So that
Yeah,
how was the procedure? How much pain did you have afterwards?
very little.
How many pain pills did you take?
Not very many. You gave me a prescription, and
You gave about 20 pills. You probably took what, a couple?
yeah,
Yeah. So not much post-op pain. So that's good for my patients
yes,
to hear that it's not
it's not
a very
painful.
painful surgery,
No.
And it worked almost immediately, didn't
It
it?
did. A
That's
couple
right.
days because the other, the incisions and
Incision
stuff
is about an inch and a half,
Creates-
little
created
incision
some
there.
pain there.
Comes from this side, comes
Yep.
across, but there's no incision middle of the back, it's all from the side,
No.
and so that spacer, that bolt is in there, and it's dilating, opening things up, and you've really had tremendous improvements. So
Yes, and I feel a lot greater.
wow,
I'm not housebound anymore.
oh, it's amazing.
Okay, so it is amazing.
Okay,
It's really
well,
amazing.
well, thank you for sharing your story with us.
Well, you're
Appreciate
quite welcome,
it.
doctor.
Okay,
Thank you
good.
for what you do.
My pleasure.